Over the years, there's been many myths and misconceptions on issues surrounding infertility. Examples ranging from that it is typically a woman's fault, that a woman above 35 years cannot conceive, that birth control is also a culprit of causing infertility, that as long as a man can ejaculate, he is not infertile, as well as having to wait for a year until you go and see your gynecologist. And the list goes on. But first things first, what is infertility? Well, infertility has been defined differently by many people, but for the purposes of this presentation today, we're going to define it as failure to conceive within 1 year of having frequent, unprotected sexual intercourse. But then, what is the cause, or what are some of the causes of infertility? Well, there are general and specific to men and women causes of infertility. The general causes cut across both, and these include age. The younger an individual is, the higher their rates of fertility. The older an individual gets, the lower the rates of their fertility. Their diet also has a bearing on their fertility. Their weight, them being either overweight or underweight, can also have a bearing on their fertility rate. Their health, the state of their health, as well as their lifestyle. Do they drink too much alcohol? Do they smoke? Do they exercise? Do they over or under exercise? All those have a bearing on how fertile an individual is. When we come specifically to men, these include a low sperm count, a reduced sperm mobility, an unusual sperm shape that could also affect the way the sperm moves, hormonal imbalance, some diseases, radiation, as well as chemotherapy. When we come to women specifically, their ability to conceive begins to drop at around the ages of 32 years old, thereabout, as well as certain STIs or sexually transmitted infections such as chlamydia. These tend to block the fallopian tubes as well as the scrotum in men. But then, what is there any treatment, or what chances are there in case somebody is presenting with infertility? Well, there are a lot of options out there. When you notice that you could be having some issues with your fertility, or a relative or a friend, you can always be there to advise them to go and see a medical personnel, a gynecologist to be specific, and these are going to better advise and examine them. So there are several options out there, and one of the advices that your gynecologist is going to give you is one that is going to change your sexual lifestyle, targeting especially at around the time of ovulation to increase the chances of pregnancy. There could be some medication that either the male or the female could be given that are going to increase the chances of conceiving. Other options available include intrauterine insemination or in vitro fertilization, both of which facilitate conception. There are many other options out there. So biggest advice is go and visit your gynecologist, be examined, and good management is going to be given to you. A question at the back of my head is, can physiotherapy also help in cases of infertility? Yes, physiotherapy can help in cases of infertility. And the area at which physiotherapy mainly focuses on is along the fallopian tubes. Because when you look at the female reproductive system, we have the ovaries, we've got the fallopian tube, the uterus down here, as well as the vagina or the opening. When the egg is released, it passes through the fallopian tube, and as you can see, the fallopian tube initially is thicker or is it wider, but as it starts coming towards the uterus, it begins to narrow down, and many times it is at this point or at this junction that the sperm gets to meet the egg for fertilization to take place. But many times, sometimes when you look at the earlier talked about STI, for example, chlamydia, it would create scar tissue around this part, around this fallopian tube, making the tube itself become less mobile and then just trapping both the sperm and the egg for it not to become fertilized. So physiotherapy in this instance comes to mobilize the ovarian tubes around there, bearing in mind that in the abdomen we've got so many organs, we've got the kidneys, we've got the intestines, muscles, everything. So physiotherapy comes in to mobilize using a combination of different techniques that are just going to mobilize and at least promote the movement and the mobility of the fallopian tube to cause conception. There are many other methods that can help an individual conceive. It is also good to mention, however, that sometimes, even with all these treatments available, some individuals just cannot conceive. It's just not in the cards. Okay, so in as much as other people could seek medical help, they could have all the services given, sometimes conception just fails. It could either be on the male side or on the female side. But the most important thing is that you go and have yourself examined by a gynecologist and advice to be given from there. For today, we're going to end here. If you got any contributions, comments, or questions, please pass them down to the comment section and I'll be very, very excited to read them. From here, it's bye-bye.